Hi everybody, Chris here. I hope you're all keeping well. I've got another research paper to talk to you about tonight, and I found this one of particular interest, and I'll talk to you about the details about that and why that is. Now, it's a research study that was done more recently in 2010, again in Canada, and it's a piece of research which has been called the CHIRO study, but CHIRO actually stands for Chiropractic Hospital-Based Interventions Research Outcomes Study. So whether or not that happened by accident or not, I'm not sure. I think probably not. But it was a study done by a chap called Paul Bishop. Now, whenever I'm looking into research, I'm always curious to see who the actual author of the research is, as it gives you an idea of who's done it, why they've done it, if there's potentially going to be any bias into it. And this particular study was really interesting. And by the way, you can find this in the Spine Journal, which is a very well thought of journal. And all you have to do, if you Google CHIRO study, CHIRO, 2010 in Google, you can find the abstract and look at this one yourself. So the chap who authored this study, I've got the notes on him now just so I can read from it, is a guy called Dr. Paul Bishop. And he has a combined qualification of being a chiropractor, he's a medical doctor, and he's a research scientist. So pretty smart guy. He is a clinical professor in the Division of Spine Department of Orthopedic Surgery at the University of British Columbia. He has completed the North American Spine Society training program to administer image-guided therapeutic and diagnostic spine injections, and he is the past director of the Chronic Back Pain Clinic and Acute Disc Clinic. Member of editorial boards of 4 spine-related journals, and the list goes on. So there's lots of information on this guy, and you can see he doesn't have any reason whatsoever to be biased. He basically covers everything when it comes to treating people with spinal issues, whether that's medical management, chiropractic, and even surgery. So this guy just wants to know what the best one is to use. Now, his study was a randomized controlled trial, which is kind of what you look for in for a gold standard type of research paper. And not going into too much detail, but it concluded that outcomes for those who received chiropractic spinal manipulation was greater than those who had family physician care, which would be your medication, physiotherapy, and so on. So I thought that was quite interesting, and like I said, please have a little look yourself. Google CHIRO study, CHIRO, Bishop 2010, and I'd be really interested to hear anyone's thoughts on these studies as well. Have a good evening. Bye.